transmitiendo nuestra comunidad al mundo.
Good morning, everyone. Thanks to all our followers on our Facebook Live session from the Mariposa Community Health Center. Our site is called We Love Nogales. We are transmitting from the Mariposa Community Health Center here in Nogales. My name is Eladio Pereira. I'm the Chief Medical Officer. And here with me is Edgardo and Marco, who are helping us with the transmission. Thank you very much to them for making this possible. I also want to thank the Mariposa leadership for supporting this activity. This is our live session today, Friday, October the 9th, 2020. And it's consistent with our desire to improve our communication with our community, given all the challenges that we continue to have with COVID-19. We hope to cover a few things today. I hope to talk about testing and then isolation and quarantine. I will follow my comments with a couple of new articles regarding transmission and the drug called hydroxychloroquine, and that came out this week. As you know, there has been increasing emphasis on testing as a tool to mitigate the spread of the virus. There are two kinds of tests. There's one test called the viral test, which detects the RNA of SARS-CoV-2 or an antigen, and that's a test to diagnose a current infection. The second test is called the antibody test, and it tells us whether you've had a past infection. At the moment, at Mariposa, for the most part, we use a viral test, either the MP swab, and then this week, we began using the saliva test with the same technology, the polymerase chain reaction. Wanted to review a few important concepts using CDC guidelines. At Mariposa, we use them extensively to make decisions regarding our approach to COVID-19. The first one is the fact that the CDC does recommend that anyone who may have symptoms of COVID-19 be tested. Those symptoms may include fever, cough, shortness of breath, nausea, diarrhea, muscle aches. And as I reported last week, a very specific symptom, acute loss of smell and taste, seem to be very consistent with COVID-19 infection. And at the moment, at least in primary care, when we see someone with loss of smell and taste, COVID-19 should be at the top of the list. In addition, persons who have had close contact with someone with a confirmed case of COVID-19, typically close contact defined as 6 feet for at least 15 minutes. And then the other groups that we may choose to test based on local needs, those may include individuals in congregate settings that may include the school system as well. Typically, the results are reported as either positive or negative. The positive test indicates active infection, and recommendation by CDC are clear, and we'll discuss that in a moment. If the test is negative, it probably means you're not infected at the time. However, in someone who was tested because they have symptoms, a false negative test should be considered, and those individuals should stay home. That's why it's so important to interpret the test in the right clinical setting. We do get questions regarding isolation versus quarantine, and I want to cover those two concepts at this moment. The first one is isolation. Isolation means that we want to keep someone who's infected with SARS-CoV-2 away from others, even in their own home. If an individual has been diagnosed with this infection, they should stay in a separate room with proper precautions to isolate them from other household members. Quarantine means keeping someone who may have been exposed to the virus away from others. So they don't have an active infection, but essentially they're being observed for possible development of symptoms, which may include fever, cough, and shortness of breath. So it's really important that those in isolation stay home until it's safe to be around others. They should have their own, what they call sick room, and use a separate bathroom, utensil, etc. Sometimes we do recommend isolation before a test is done. For instance, if you develop symptoms very consistent with COVID-19, and for some reason you cannot be tested, we do recommend that you stay home until you get a test, or a decision is made regarding completing 10 days of isolation, even with a negative test and a high suspicion for the illness. We also recommend isolation, even in the absence of symptoms, but if the test is positive. We do have a number of patients who remain asymptomatic, but they're tested. If the test comes back positive for SARS-CoV-2, we will recommend isolation. Close contacts will then go into quarantine for 14 days. We do get questions regarding quarantine and isolation, the different tenths of days. Quarantine has to do with the incubation period of SARS-CoV-2, which could be 2 to 14 days, average 5 to 7. And for that reason, we recommend 14 days of quarantine. Isolation is different. CDC and others have conducted studies looking at live virus. And for most people with mild to moderate illness, there is essentially no live virus after day 10. For those who are immunocompromised, the recommendations are different and may extend to 20 days. When you're in isolation, you should stay home, except to get medical care. You should monitor your symptoms. It's really important to be alert to warning signs, and that includes shortness of breath. And if that's the case, please seek emergency medical care. Stay in a separate room from other household members if possible. Use a separate bathroom if possible, and avoid contact with other household members and pets. Sometimes we don't think about our pets, and we do know that pets can get SARS-CoV-2 infection as well. Do not share personal household items such as cups, towels, and utensils, as I said earlier, and wear a mask when you are around people. Again, those are recommendations when you stay home after SARS-CoV-2 infection has been diagnosed. We all sometimes get questions about isolation, and certainly isolation is a challenge, but the CDC recommendations are as following. If you've been diagnosed with SARS-CoV-2 or you suspect that you have it or have symptoms consistent with it, the CDC does recommend that you be in isolation for at least 10 days since the symptoms first appear. If you don't have any symptoms, we use the date of the positive test, the day that you actually had the test done. The second criteria is at least 24 hours with no fever, without using fever-reducing medications. And other symptoms of COVID-19 are improving. It doesn't say resolution of symptoms, it says improvement in symptoms. We do know that, for instance, loss of taste and smell may persist for weeks or months after recovery. And after day 10, if they're doing well, otherwise they have no fever, they can come off isolation. If the patient has had more severe illness, hospitalization, ICU care, other immunocompromised, the period of isolation may be extended for up to 20 days. Virus has been found in those individuals with a weakened immune system longer than those individuals who don't have a weakened immune system. So in that case, we may recommend longer than 10 days. At the moment, we do not recommend retesting for those positive, particularly in the first 3 months, if the individual has recovered and remains asymptomatic. No retesting is needed. We would recommend that individual comes off isolation and return to his typical activities. Voy a hablar en español acerca de las dos pruebas que tenemos. La primera prueba es la prueba viral. Nos indica infección activa, y la prueba del anticuerpo representa infección en el pasado. En este momento recomendamos la prueba viral en aquellos pacientes que tienen síntomas de COVID-19 que incluyen fiebre, tos, dificultad respirar o pérdida del sentido del olfato o del sabor. En aquellos individuos que han tenido contacto cercano a un caso de COVID-19, por definición, menos de 6 pies, por lo menos 15 minutos. En otras ocasiones podemos recomendar la prueba cuando el paciente ha estado en un área congregada, como las escuelas. Los resultados se reportan o positivo o negativo. Positivo indica que hay infección. Negativo puede indicar que no hay infección, o puede ser un negativo falso, particularmente si hay síntomas consistentes. Esos pacientes deben consultar con el doctor para decidir qué es lo apropiado. Aislamiento quiere decir separar un paciente con la enfermedad de SARS-CoV-2 o COVID-19 separado de aquellos que no la tienen. Se recomienda aislamiento por lo menos 10 días y no fiebre por 24 horas, y mejoran los síntomas. No dice que los síntomas hayan desaparecido totalmente, pero mejora de síntomas. Cuarentenas es esencialmente un periodo de observación cuando el paciente ha estado en contacto cercano con una persona con la enfermedad y todavía no está infectada. Esa es la diferencia entre aislamiento y cuarentena. En este momento recomendamos aislamiento a aquellos pacientes que tienen síntomas de COVID-19 o que han tenido la prueba positiva. Aunque el paciente no se ha hecho la prueba, pero los síntomas son muy consistentes de COVID-19, esos pacientes deben estar en aislamiento para evitar que se transmita el virus a otras personas. En la casa, cuando se están recobrando, importante monitorear los síntomas. Hay ciertos síntomas importantes que requieren cuidado médico, incluye problemas al respirar. Es importante estar en un cuarto separado de otros miembros de la familia, tener un baño separado, evitar contacto con otros miembros del hogar, incluyendo mascotas. No se debe usar o compartir copas, toallas o utensilios. Es importante no utilizar o compartir estos aspectos personales y utilizar la máscara. En aquellos pacientes cuyo sistema inmune está afectado, quizás el periodo de aislamiento se puede extender hasta 20 días. Se ha encontrado virus en estos pacientes con enfermedad más seria y el sistema inmune débil. Se ha encontrado virus por más de 10 días y por eso se ha recomendado los 20 días. So those are the review of the CDC guidelines for testing, who should be tested, what the results are, and the recommendations for a positive test and a negative test. A couple of news this week that I wanted to review with you. Clearly, the treatment of COVID-19 infection is evolving rapidly. There are a number of tests or treatments that have been studied and continue to be studied, from remdesivir to convalescent plasma to antibody cocktails, etc. And those are typically used in patients who are hospitalized. The one that we've been talking about a lot is a drug called hydroxychloroquine, which has been around for a long time. We use it in patients who have systemic lupus erythematosus, particularly those who have skin involvement and arthritis. It's our workhorse for that illness. A study published in the New England Journal of Medicine the last few days from the UK at the University of Oxford shows that essentially hydroxychloroquine does nothing to prevent COVID-19 related death. So at the moment there's really no clinical benefit, and at this point we're not using it. That's something that's been looked at increasingly, but at least at the moment the clinical data suggests that there's no clinical benefit. The second article has to do with how coronavirus is transmitted. We do know that it's in the air. We've had some discrepancies about how easy it is. We do know that it's fairly easy to transmit. The CDC and others have acknowledged that it could be airborne, meaning that the particles could be smaller and they travel longer. We do know that there have been particles found in the air that have traveled more than 6 feet. I think what this says, at least for us, is that we just need to be careful, assume that the virus is easily transmissible, keep a distance of at least 6 feet and maybe longer, wear a mask, because we know that it is transmitted at least by droplet and maybe airborne. Airborne has different consequences. We do know there are a few organisms that are transmitted this way. We know that chickenpox is, measles, and tuberculosis. Looks like SARS-CoV-2 may be in the same category. Means that in the hospitals we have to use PPE and N95 masks for those infections that are transmitted via the airborne route. but essentially it tells us just have to be careful, assume that it's in the air, wear your mask, keep the distance, and wash your hands. I think that's all I have for today. In summary, we've reviewed the CDC guidelines for testing. We've reviewed the isolation, the difference between isolation and quarantine, and the recommendations for isolation from CDC. We look at these recommendations often at Mariposa to make determinations for our patients. And then we've reviewed the new study on hydroxychloroquine and the acknowledgement that this virus could be airborne as reported this past week. I think we're going to end our session today, Friday, October the 9th. I'd like to thank everyone for your support during this COVID-19 era. We continue to work with our patients, our community, our schools to keep everybody safe. Don't lower your guard, wear your mask, wash your hands, and keep your distance. Thank you very much, and we'll see you next week. Thank you, Edgardo and Marco, for your help, and thank you for Mariposa leadership. Have a good weekend. Thank you very much.
Transmitiendo nuestra comunidad al mundo.